Hello and welcome. I'm YCY, and today we have something exciting to share with you. Let's dive right in. And today we're diving into a really crucial topic, home first aid mistakes and how to get it right. Let's be honest, when someone gets hurt at home, our first instinct is to help. But sometimes, good intentions can go wrong if we're not sure what we're doing. Think about it. What would you do if your kiddo scraped their knee? Or if someone in your family accidentally touched a hot stove? In those moments, knowing the right steps can make a huge difference, maybe even save a life. So, today's goal is simple. We're going to shine a light on those common first aid blunders we often make at home. More importantly, we'll walk through the correct, science-backed ways to handle these situations. Consider this your go-to guide for feeling more confident and prepared to handle those unexpected bumps and bruises right here in your own home. Part 1. Unmasking common first aid mistakes at home. Let's get straight to it. These are some of the most frequent first aid errors people make in their homes. Recognizing these is the first step towards doing things the right way. 1. The rubbing alcohol and hydrogen peroxide fix-all. This is a classic. For every little cut or scrape, many of us instinctively reach for the rubbing alcohol, usually 90% isopropyl, or hydrogen peroxide. What's the mistake? High concentration rubbing alcohol can actually damage healthy skin cells around the wound, slowing down healing and causing unnecessary pain and irritation. Hydrogen peroxide bubbles when it contacts blood and tissue, and while it looks like it's cleaning, it's mostly a chemical reaction that doesn't effectively remove all bacteria. Regular use can even hinder the formation of new tissue. The right way: wash your hands. This is the absolute first step to prevent introducing more germs to the wound. Clean the wound. Use clean tap water or a sterile saline solution to gently rinse away dirt and debris. Mild antiseptic around the wound. If needed, apply a mild antiseptic like 70% isopropyl alcohol or povidone iodine around the wound, avoiding direct contact with the open area. Bandage if necessary. Small cuts might not need a bandage. For scrapes or deeper cuts, cover with a clean bandage to protect from dirt and bacteria. Change the bandage daily. 2. The toothpaste and butter burn remedy. Burns happen, especially in the kitchen. When they do, many folks reach for household items like toothpaste, butter, or even kitchen oils. What's the mistake? These things don't cool the burn or relieve pain effectively. Toothpaste can trap heat and potentially cause infection. Butter and oils can create a barrier that prevents heat from escaping and might even introduce bacteria. The right way: stop the burning source. Immediately remove the person from the heat source. Cool the burn right away. Immerse the burned area in cool, not ice cold, running water for 15 to 20 minutes or until the pain subsides. If immersion isn't possible, apply cool, wet compresses. Cover the burn. After cooling, loosely cover the burn with a clean, dry, non-stick bandage or cloth to protect it from dirt and bacteria. Don't apply it too tightly. Leave blisters alone. Blisters help protect the skin underneath. If they break on their own, gently clean the area with mild soap and water and cover it with a bandage. Don't apply ointments or creams immediately, unless specifically instructed by a doctor. Seek medical attention for large or deep burns, burns on the face, neck, hands, feet, or genitals, or if there are signs of infection. 3. The tilt your head back nosebleed fix. Nosebleeds are common, especially with dry air or minor bumps. The natural reaction for many is to tilt the head back to stop the bleeding. What's the mistake? Tilting your head back allows blood to flow down your throat, which can cause choking, difficulty breathing, or even nausea and vomiting if swallowed. It also makes it harder to see how much blood has been lost. The right way, sit upright and lean forward. This helps the blood flow out of the nose. Pinch the soft part of the nose. Use your thumb and index finger to firmly pinch the soft part of your nose, just below the bony bridge, for 10 to 15 minutes continuously. Breathe through your mouth. Apply a cold compress. Placing a cold compress across the bridge of the nose can help constrict blood vessels. Release slowly. After the 15th of October minutes, gently release the pressure and check if the bleeding has stopped. If not, repeat the process. Avoid packing too deeply. You can gently place a clean piece of gauze in the nostril if needed, but don't pack it tightly or too far. Seek medical help. If the bleeding is heavy, doesn't stop after 20 to 30 minutes of applying pressure, or if nosebleeds are frequent or accompanied by other symptoms like dizziness. 4. The hard back blow for choking. Seeing someone choke can be scary. A common reaction is to give them hard slaps on the back. What's the mistake? While back blows can sometimes dislodge an object that's only partially blocking the airway, forceful back blows when the airway is completely blocked can actually push the object further down, making the situation worse. The right way, depending on the person's condition, encourage coughing. If the person can still cough forcefully, encourage them to keep coughing. Heimlich maneuver. For adults and children over 1 year old, stand behind the person and wrap your arms around their waist. Make a fist with one hand and place it slightly above their navel and below their rib cage. Grasp your fist with your other hand. Give quick, upward and inward thrusts. Repeat until the object is dislodged or the person becomes unconscious. Infant choking, under 1 year old. Position infant face down along your forearm using your thigh for support. Keep the infant's head lower than their body. Give 5 firm back blows. Use the heel of the hand to strike between the shoulder blades. Turn infant face up with their head lower than their body. Give 5 quick chest thrusts. Chest thrusts should be about 1.5 inches deep. Continue giving 5 back blows and 5 chest thrusts. Continue until the infant can cough or cry or becomes unresponsive. If the infant becomes unresponsive, lower them to a firm, flat surface and begin starting with compressions according to your level of training. Trained responders, after each set of compressions and before attempting breaths, open the infant's mouth. Look for an object. If seen, remove it using your pinky. Never do a pinky sweep unless you actually see the object. Important, if the person cannot cough, speak, or breathe, it's a sign of a completely blocked airway. Call 911 immediately and perform the appropriate first aid techniques. 5. The rub it out and pop it back in, for sprains and dislocations. After a twist or fall that seems like a sprain or possible dislocation, many people instinctively try to massage the area or pop the joint back into place. What's the mistake? Massaging a sprain can increase swelling and pain. Trying to force a joint back into place without medical training can damage surrounding ligaments, blood vessels, and nerves. The right way, ICE principle: rest. Stop using the injured limb or joint. Ice. Apply ice packs wrapped in a cloth for 15 to 20 minutes at a time, every 2 to 3 hours, for the first 24 to 48 hours. Compression. Wrap the injured area with a mild compression bandage to help reduce swelling. Don't wrap it too tightly. Elevation. Keep the injured area raised above the level of the heart to further reduce swelling. Seek medical attention. See a doctor for proper diagnosis and treatment. 6. Any old medicine will do for poisoning. In cases of suspected food poisoning or chemical ingestion, some people might try to give the person any available remedy or induce vomiting. What's the mistake? Giving the wrong antidote or inducing vomiting in certain types of poisoning, like corrosive substances, can cause more harm than good. The right way: identify the poison. If possible, look for containers, labels, or any remaining substance. Call Poison Control immediately. 1-800-222-1222. In the US, they have specific instructions based on the type of poison. Follow their instructions. They will guide you on the necessary first aid steps. Do not induce vomiting unless instructed to do so by Poison Control or a medical professional. Do not give anything to eat or drink unless instructed to do so. Seek medical attention as directed. Part 2. Golden Rules for Home First Aid. Beyond addressing specific situations, here are some essential principles to keep in mind for any first aid scenario at home. Stay calm. This is paramount. Panic can lead to poor decisions. Take a deep breath and try to reassure the person. Ensure safety. Before approaching, make sure the environment is safe for both you and the injured person, e.g. turn off electricity, move away from hazards. Assess the situation quickly. Check the person's responsiveness, breathing, and pulse. Determine the nature of the injury or illness. Call for help when needed. Don't hesitate to call 911 or your local emergency number for serious situations or when you're unsure how to proceed. Prioritize life-threatening issues. Address breathing problems, severe bleeding, and unconsciousness first. Avoid moving an injured person unnecessarily, especially if you suspect a head, neck, or back injury. Ask about medical history. If the person is conscious, try to find out about any allergies, medical conditions, or medications they are taking. Don't give food or drink to an unconscious person. This can cause choking. Keep a well-stocked first aid kit. Make sure it includes bandages, antiseptic wipes, gauze, medical tape, pain relievers, tweezers, and any personal medications needed. Check expiration dates regularly. Consider first aid training. Taking a CPR and basic first aid course can equip you with invaluable skills and confidence. Part 3. Equipping your home. The essential first aid kit. A well-equipped first aid kit is your frontline defense in case of minor injuries. Here's a list of essential items to have on hand: assorted bandages, adhesive bandages, various sizes, gauze pads, elastic bandages, medical tape, to secure bandages, antiseptic wipes, for cleaning skin before applying bandages, gauze pads, various sizes, sterile, medical gloves, non-latex to protect yourself from bodily fluids, tweezers, for removing small splinters or debris, scissors, with blunt tips, for cutting tape and bandages, pain relievers, over-the-counter options like acetaminophen, Tylenol, and ibuprofen, Advil, Motrin, antihistamines, for allergic reactions, non-drowsy options are available, hydrocortisone cream, for minor skin irritations and itching, thermometer, to check for fever, first aid guide, a basic manual for quick reference, emergency contact information, including your local emergency number, Poison Control, and your doctor's number. Make it a habit to check your first aid kit regularly, replenish used items, and discard anything that has expired. In conclusion, Being prepared to handle minor emergencies at home is a responsible and caring act. By understanding these common first aid mistakes and knowing the correct steps, you can confidently respond to unexpected situations and potentially make a significant difference in the well-being of your loved ones. Remember, staying calm, having the right knowledge, and not hesitating to call for professional help when needed are key. Thank you for taking the time to learn more about home first aid today. Stay safe and be prepared. If you have any questions, please feel free to ask. Thank you for watching. I hope you found this helpful and enjoyable. Don't forget to follow for more, and I'll see you in the next one. Take care.